In today's SnapOrtho sketch, we will learn about femoral neck fractures. This house will help us learn each type of the classification. The elderly woman falling in her garden should help recall that the garden classification is used for fem neck fractures. Now let's move into the house to learn about type 1, which was represented by the kitchen. In the kitchen, the boy is holding an incomplete assignment, which should help recall that type 1 is an incomplete fracture. He is holding two keys, which should help recall valgus impacted. Now, moving on to the living room, we will learn about type 2. In this room, the kid is holding a complete assignment, which should help recall that type 2 are complete fractures. In the corner, there's a completed puzzle, which is a recurring symbol for non-displaced. In between the living room and kitchen, the boy is holding a mallet, which is a recurring symbol for surgery. Next to the boy, there's a toolbox with 3 screws, which should help recall that type 1 and type 2 fractures are treated with CRPP. Now we move upstairs to learn about type 3 and 4. In the bedroom, we will learn about type 3. The boy is wearing a mission complete shirt to help recall that type 3 fractures are also complete. Next to the boy, there is a puzzle that is not complete, which should help recall that type 3 fractures are partially displaced. Now in the bathroom, we'll learn about type 4. This girl is also wearing a mission complete shirt, which should help recall that type 4 fractures are also complete. Next to the girl, there is a completely displaced baseball bat, which should help recall the hallmark of type 4 fractures is completely displaced. In between these two rooms, there's a new tire, which is our symbol for arthroplasty. These characters will help us learn about the different types of arthroplasty. The frail woman in the wheelchair is holding a normal ice cream cone, which will represent hemiarthroplasty. On the other hand, the active man is holding an ice cream cone in a cup, which represents total hip arthroplasty. And that's all we have today for this sketch on femoral neck fractures. Remember that type 1 are incomplete, type 2 are complete non-displaced, type 3 are complete and partially displaced, and type 4 are complete and displaced. For treatment, remember that type 1 and 2 are treated with CRPP, and type 3 and 4 are typically treated with arthroplasty, whether that be hemi or total arthroplasty.